Okay. So how many in here want to have kids or when they're older? You can raise your hands. Only a few. Nobody wants kids. Okay, well, out of those few, how many of you guys would absolutely be devastated if you or your wife couldn't conceive kids or weren't able to? Okay, I'm here to tell you about surrogacy, and my proposition is that surrogacy is the best way to overcome infertility. Some of you might be wondering what surrogacy is. It's the agreement between a woman and the couple to have her carry and deliver their baby. Just a little background information. There's two types of surrogacy. One is traditional and the other is gestational. Traditional is where the surrogate mother is the biological mother, and the intended father's sperm is used to impregnate her and then signs over the right as the mother. Gestational is where the surrogate mother is not the biological mother. The eggs from the mother and the sperm from the father are used to create an embryo, and it is then put inside of the surrogate mother, and she has no legal rights to the child. Okay, so surrogacy is definitely the best way to overcome fertility. One is because surrogacy brings a family to one that cannot conceive. Two, other options to infertility can be risky with many side effects. And three, surrogacy offers the best positive aspects and outcomes. Surrogacy brings a family to one that cannot conceive. I mean, some people are just born, they can't conceive, women or male even. 6.3 women are infertile as of 2000, about 10.2% of women in the United States. I mean, if you really think about that, that's a lot. And it's expected to reach 7.7 million in the year 2025. Along with that, some families have problems because of extreme weight levels. You would never have guessed it, but 30% of estrogen in women is produced in fat cells by transforming adrenal man hormones into estrogen. And you definitely need a normal hormonal balance in your body to conceive a baby. And not having enough fat cells can shut down your reproductive system. So you might be either overweight or underweight. Either way, you need to have a good balance of hormones. Some women cannot conceive because they're too old. By the age of 45, the chances of you having a child decline to 15%. With that, a lot of problems can arise. Different ones include a higher risk of chromosomal abnormalities that occur in the eggs as they age, a higher risk of miscarriage, and more likely to have health problems. Being old, shouldn't prevent you from having a child. Other factors include smoking, alcohol consumption, caffeine, and sexual practices. Women who smoke one or more packs a day, or who start smoking before the age of 18 or are more at risk. I know that our professor asked you guys earlier in the quarter if any of you guys smoked, and you said no, so hopefully you don't have that risk. And men who smoke have poorer sperm quality than non-smokers. Also with that, heavy marijuana smoking has a negative effect on fertility as well. So why should all these factors prevent you from having a child? Well, they don't necessarily have to. Also, surrogacy is the best way to overcome infertility because other options to infertility can be risky with many side effects. One option is ovulation induction, which is also known as using fertility drugs to produce a child. This is used to stimulate the follicles in your ovaries to produce more than one egg during a cycle. Some side effects with this include hair loss, fatigue, multiple births, OHSS, which is also known as ovarian hyperstimulation syndrome, and that results in severe pain in chest and pelvis, bloating, nausea, vomiting, weight gain, and difficulty breathing. Another option is intrauterine insemination, which is also IUI, and that is when the sperm is directly inserted into the uterine cavity with a catheter near the time of ovulation. The drugs used here are Follistim AQ, and it's a process which could also cause OHSS and severe lung problems, and in rare cases, death. You should definitely not put yourself in that position, so why would anybody want to put themselves in that position? And you don't necessarily have to. Surrogacy offers the best possible positive aspects and outcomes. The surrogate mother has to have a previous healthy pregnancy, and they go through extensive research to provide you with the right fit. They definitely don't just pick up somebody off the street to have your baby. They go through extensive research, making sure, that all of her, tracks are healthy, and making sure you like her as a person, and, she's friendly and whatnot, because she's going to be carrying your baby for 9 months. And the baby can be biologically theirs, as I said before, as gestational term for surrogacy. It's just being housed by the woman until the baby is born. And you receive a healthy baby, and this process is more secure and successful than any of the medical technologies. You don't have to use drugs. Obviously, the pregnant woman is, but I mean, they're definitely more safe than, the ones that can cause death. It is used it used to only be 40% achievement rate, but now it's risen to 90%. So I mean, obviously it's not 100%, but it's definitely better than, not a guarantee, and you might have to use the drugs more than once in order to get a baby fertile inside of you. So with this, I hope you all understand how surrogacy is the best way to overcome infertility, because it definitely is. Thank you.
All right, LeAnne, I thought you did a nice job on the presentation. You did a good job outlining and previewing what the supporting points were going to be. The problem with the proposition and the supporting points is that there are a lot of value claims based in here. When you argue that something is the best, then we're going to have some standard by which we're going to measure the best. Is it cost? Is it effectiveness? Is it the uniqueness of the child? Is it the degree of convenience? You need to give us some criteria, and those criteria, of course, are going to be value-based, and that's, I think, a little bit problematic for this argument. You needed to maybe reduce it down to something about surrogacy being the most effective way to overcome infertility, for instance, because it's got a greater degree of certainty and a greater degree of security, and that would, I think, make your argument a lot more factually based. The transitions between the points internally were not as clear as they could be. There was one that seemed a little bit awkward to me. You've got a lot of information in the presentation, but I didn't hear a source citation for any of it, and I think that's a little bit problematic. There's some statistical information early on that was a little bit confusing. You said 6.3 women are infertile, and I assume that there's a millions in there someplace, but it didn't come out when you were saying it. It came out in the second part when you were doing a projected future issue on infertility. I thought you explained the concepts pretty clearly. You do need to be able to quantify the risks and the problems that are associated with the alternatives a little bit more, since you did mention that those risks exist. Well, how are we supposed to compare if we don't know how great the risk is, what kind of percentages are involved, that sort of thing? All right, thank you.